I would say the first time I really thought about robotic surgery as a potential for veterinary medicine was 6 years ago. It's quite an undertaking, and we're the first at Cornell to have a robot at the veterinary school, and so there are a lot of unanswered questions. I am an associate professor of small animal surgery here at Cornell University, and I'm also a minimally invasive fellow. My reason for getting the robot was because I felt that we had kind of stalled a little bit with some of the minimally invasive surgeries we were able to perform with dogs and cats. We just couldn't go to that next level without this technology. And so I wanted to research that. I wanted to figure out, are there procedures that we can do that we're not doing now in a minimally invasive way for our pets? So many of these robots and these technologies have been tested on animals, and then animals don't get the benefit of it. So I really wanted to take back some of that technology for us.
My name is Carrie Lee Ryder, and Sunny is my heart dog. Sunny was the mastiff that I think I have ever been most excited about because I waited for her. I got a book when I was 11 years old, and it had all the different dog breeds in it. And when I was flipping through, I came across the English Mastiff, and I knew someday I was going to have a Mastiff. When she got here, she was everything I'd hoped for. She would do anything for me, anything to please me. It is in the dog's best interest to be spayed and have the gastro surgery for them to live a longer, healthier life. I am really grateful that I was chosen for this robotic surgery with my dog. I am going through a difficult time right now, and a spay, let alone a gastro procedure, I would not have been able to have done probably this year. Cornell's program actually offered the spay with gastro. I'm really grateful that they offered that as part of the procedure.
Gastropexy is a procedure in which we tack or suture the stomach to the right side of the body wall. We do it in large breed and giant breed dogs because they get a disease called gastric dilatation and volvulus, where their stomach flips on itself, and they can die from that. This is a preventable disease, and so for us to be able to not only deal with it in sort of like a minimally invasive way, so the pain and discomfort for the pet is basically taken away, but to prevent something they could die from and take the weight of that off of the owner's shoulders is really extremely meaningful for me.
Really?
Yes.
This is for Sunny?
Yes.
Looks like Sunny is seeing soft tissue surgery.
I am a little nervous about the surgery, but I do know that she's in the best hands at Cornell, and I'm grateful for this opportunity and that she can be a part of their research program.
Hi, baby.
Hi, I'm Dr. Buote. Nice to meet you.
Nice to meet you.
The idea behind these minimally invasive procedures is to really decrease the discomfort that she's in during the procedure as well as after. Some of the huge benefit is for what we're doing on the inside. So instead of having to really tug and pull on stuff, which can cause pain, we're able to sort of gently lift and suture within her abdomen so that it's less uncomfortable for her, not only after, but during the procedure. She's gonna have incisions on her belly, but they're all gonna be about 8 millimeters, which is about this big. So she'll probably have 3 of those. I'll see you in a few minutes. Okay.
Good girl. Thank you. Yep, thank you.
These are $2 million instruments fresh out of the box, so to speak. And so without having industry support, projects like these die in the water. It is really difficult. I mean, I can't tell you how many phone calls and emails we had to send before we found R2 Surgical. And it was life-changing for my project and for my program here because they immediately were interested in helping us.
Companies like R2 that are willing to work with the veterinary sphere and help us to grow and advance this, and giving us access to these products is really an exciting thing to be part of.
Dr. Buote was the first client of ours in the veterinary space. I think she was very encouraged to know that there is a more affordable secondhand robot option available to her. They're using the robot, I think, as it was originally intended. It's there to create a much safer surgery experience, but Cornell is taking an opportunity to kind of break boundaries and see what else can be done, especially for our four-legged friends.
Without those type of options and opportunities, we still would be very limited in terms of any ability to get our hands on robotic surgery and learn how to use them in veterinary patients.
Me first. Yeah. That is the thing he likes to do too, is he wants to be first everywhere. When we got Finley, he was about 2.5 years old.
He was not doing very well in the shelter. The shelter, is great, but he was really skinny and he needed to go to a home environment as soon as possible. And so we were his foster parents until he could get the surgery that he needed.
Finley did have the first robotic gastropexy in the United States. It was doubly meaningful to us because he was a foster dog at the time, and so we were able to provide this procedure that he desperately needed. He's getting adopted by loving parents. It was just like a win-win for everybody, and we were so excited to be a part of that. Knowing that we were going to use donation funds and we were going to be pushing the edges with these surgeries, the first thing that came to mind to me was like, who can we help best with this? We do a lot with our shelters. We enroll their patients as often as we can because we feel like it's such a great service to the community.
Having the gastropexy surgery helps adopt these dogs out into homes because the adopters may not have that extra money to put into that animal.
The shelter worked with Cornell and they were awesome and put together a whole plan for Finley. And so he was able to get neutered and get the gastropexy done on the same day.
We were so excited when we heard about, the type of procedure that he was going to get. A lot of Great Danes get gastropexies, but having this new technology involved is pretty exciting.
The Da Vinci instrumentation is actually called endo-wrist, and that's because it has this amazing articulation. And what does that mean for us as a surgeon? It means I can move tissue away really delicately, and I can suture more easily because I can use my wrist just like I do in an open surgery.
The Da Vinci robot has been around for a little over 20 years. It was developed by Intuitive Surgical, and they did a truly exemplary job. It currently is the industry standard for surgical robotics.
The difference is the elegance of the surgery is much better, and that does mean that there's less pain, less discomfort to the person or dog, right? It always comes back to how do you start a platform like this? How do you initiate brand new procedures? We don't have a book to read because we're the first ones doing it. So we're figuring out how do we drape it? How do we position it? The positioning is really different with the robot compared to laparoscopy. So that's been a huge learning curve for me. I really feel like my job is also to spark excitement and interest in this field. So it doesn't make sense to me to have a robotic procedure and have the resident never get to lay their hands on the surgeon console.
Being a resident here, I sort of have this unique opportunity to think about the Da Vinci and what we can do in veterinary surgery with the Da Vinci. That was the first time I've ever had the opportunity to try anything with the robot, so that was a really exciting new experience for me.
To date, there's not a lot of programs that offer advanced minimally invasive surgery training, and we're very lucky that Dr. Buote has taught us these techniques and then also has a simulator in her lab. So prior to doing any actual robotic surgery on live patients, I've been working on the simulator.
What the robot really signifies to students is that Cornell is a place that is innovating. So they understand that while they may not get on it, they're excited that they're at a school that puts a premium on advancing veterinary medicine.
Seeing these procedures and seeing just the tiny little incisions they need to make, you really cannot even tell that those incisions are there. After the surgery, it really felt like it was something that could be seen sooner rather than later in veterinary medicine.
It just really hit home for me. Like, one of the reasons that veterinary medicine is so cool and really highlighted the way that we're pushing veterinary medicine to be better for our patients.
You know how important those animals are to that family. So, you know, we're a part of their family once we help fix their pet up.
Hi, I'm here to pick up Sunny. On the way to pick up Sunny, I was fine. I wasn't nervous at all. And when I got there and we were waiting in the waiting room, I was definitely very nervous and trying to keep myself distracted because, well, I couldn't wait to see her, and I was glad I was bringing her home.
Hi, Sunny. Hi, Sunny.
She was a lot more awake than I expected she would be, but I don't know if much could hold Sunny down, if I'm being honest.
She has a couple of 3 small incisions.
To see how efficient it was and to see how well she's already doing post-operatively was really exciting, really cool. But as soon as she saw Mom, that tail was going 1,000 miles a minute. So that's always the best part of my day, to really see how happy they are to see their parents and get to go home.
Let's get you the heck out of here, huh?
She was definitely happy to see me. I could tell that. I was happy to see her too. It is 2 days after Sunny's surgery that went really well, and she is back to her normal, happy self. It's a huge relief. Sunny is my heart dog, so I'm really excited that she has had this surgery, and I feel comfortable and confident that she's going to have a longer, healthier, and happier life, and that makes me really excited.
I'm a dog owner too. I've got 2 big dogs at home. I know the lengths that owners will go to take care of them. The fact that we're able to provide this technology in an affordable way to more institutions like Cornell, and for them to leverage it so they can help these animals, it's incredible. It makes me emotional just thinking about it.
In the beginning, you start with procedures like gastropexy to get really familiar with how the procedures work and how the equipment works, and then you start to figure out what's next, right? Where can we really use this? There are a lot of great practices out there that could sustain a robotic program. You know, sky's the limit as to what else we might be able to do with it.
Our goal is just to spread the word and let everyone know. You thought it wasn't affordable, but now it is.
We are looking forward to supporting way more veterinary robotic surgery programs in the near future and help to completely transform all that is veterinary practice.
I don't look at this as a job. I don't even really look at this as a career. Like, this is how I define myself, is these procedures. I hope the collaboration between Cornell and R2 Surgical can act as a platform for new projects and new partnerships, because I want people to know veterinarians are constantly working to improve the lives of pets, and that requires partnerships.